Dr. Andrew Grecki here, and today I'm going to say something that other RTM companies are not going to love. I wouldn't use MedBridge or Limber for my RTM and my own practice. Not because they're evil companies, not because their technology doesn't work, but honestly, because when you really look at how they operate, their pricing model, their support structure, who they're actually built for, I think it becomes pretty clear, in my opinion, that their primary customer isn't your practice. Um, and I know that's a pretty bold statement, but it's really their investors. These companies are all backed by major investors. They're not providers. And those two things are not always aligned, right? So let me show you what I mean. Um, MedBridge and Limber Health, right? So they're both well funded, right? They're venture-backed companies. At least I know Limber Health was or is. They've raised tens of millions of dollars before even doing anything. They have marketing budgets that dwarf anything a PT practice or a company like ours could compete with, and that's fine. There's nothing wrong with that in principle, right? But here's the question I think you need to ask about any company you partner with. What is the first thing I would think of is, what does success look like for them, right? For a VC-backed company, success looks like scale, right? Maximum users, maximum revenue, maximum length of contracts, maximum cost per customer. In a business that can eventually be sold or taken public is really the goal, right? That incentive structure shapes everything. It shapes the pricing, the support, the contract terms, the platform decisions. So now really you should ask, like, well, what does success look like for your practice, right? What does success look like for your practice when it comes to RTM? And I think a program that your patients actually use, right? Reimbursements that actually come through the door, staff who aren't burdened. You want a partner who picks up the phone when something is going wrong or that you're having a challenge with. Those aren't the same goals, right? They're not aligned. And so let's talk about like how these programs make money, because this is where it gets interesting. The standard RTM revenue split in this industry is somewhere between, like 80-20 split. So you keep 80% of what insurance pays and the vendor takes 20. And so at first glance, that sounds reasonable, right? You're doing the clinical work, they're providing the platform. 80% to you seems fair. And again, this is if you're doing the monitoring yourself. But here's what that model tells me about a company's priorities. When a vendor takes 20% of every single claim for essentially providing software, right? They are incentivized to maximize the number of claims, right? Not the quality of their program. And so their revenue goes up the more patients enroll, regardless of whether those patients are getting great outcomes, and so we do things a little differently, right? Our split is roughly 50-50, and that's when we're doing the monitoring for you. And I know what you're thinking, right? Oh my gosh, that sounds worse. Like you said, stay with me, right? The reason our split looks different is because our model is different, right? We're not just providing software. We can provide just the software. That's one pathway we have, but we also can provide remote providers, PTAs, CODAs, who actually do the monitoring for you. Your staff isn't having to handle that. We're making sure that it's going well. That's fundamentally a different partnership. We share both the revenue and the work, right? And because we only make money when insurance pays, right? Performance-based pricing is what I call that, with zero upfront costs. There's no setup costs. We're deeply invested in making sure claims are clean, documentation is airtight, patients are engaging, and your program actually runs properly, right? Now, when our incentives are tied to your reimbursement, we're on the same team, right? That's important. That's an important differentiator. So here's something I want you to think about. When something goes wrong with your RTM, your program something's happening, right? And eventually something will go wrong. I promise you that. who are you going to call? With a large corporate platform, MedBridge, Limber Health, there's others, you're opening a support ticket, right? You're waiting on a queue. You're talking to someone who has never treated a patient. They're not a provider, doesn't understand PT billing, and is working from a script, right? That's not a knock, right? They're scaling. They figured out how to help, at least a little bit. They're doing their job, but their job isn't to understand your practice, right? When you work with us, when you work with me and my team, you're talking to a PT. You're talking to a PT with 16 years of private practice experience, someone who understands clinical context, someone who understands the billing nuance, the staff dynamics, because we've lived it, right? We ran our RTM program through a Blue Cross Blue Shield audit 3 years ago. We didn't panic. We didn't call a lawyer. We walked the auditors through our documentation, through our protocols. We passed, and then they came back and used that experience to build even better compliance on their end by asking us to train them, right? We improved their compliance systems, their medical chart review systems. That knowledge, that audit experience, that documentation standards, the clinical credibility, it isn't something you're going to get from a corporate software company. It's just you're not. It's something that comes from actually doing the work, right? And so I want to ask you something before I lose your attention here. When you're recommending a program to your patients, when you're putting your name on something as part of their care, does it matter to you whether the people monitoring your patients have clinical experience, clinical backgrounds? I think it does, and I think it should. I think it matters a lot. I think it matters when you're working with a company that understands your business. And with a large platform company, the people interacting with your patients, if they even have that option, they're interacting with your patient's data. They have zero clinical training. They're data processors. There's nothing wrong with that role, but it's not what we do. With our model, your patients are monitored by licensed PTAs, licensed CODAs, clinicians. Everything we're doing in our system, we've done in our own practice. So you're going to get people who understand what, my knee feels different today, what that actually means in the context of a recovery plan. That's not just better for compliance, it's better for your patients. And when it's better for your patients, they trust you more, right? They complete their plans of care, they complete their programs. And then the best part is they tell their friends, they tell their family, they leave a Google review, and they actually call out what they liked about you, which if you read our private practices reviews, they talk about the video home programs, the app that they use, the monitoring, the accountability, someone there checking on them. The clinical standard that you hold in your clinic shouldn't drop to zero the moment a patient walks out the door. Now, I'm not asking you to take my word for it, any of this. What I'm really asking you to do is look at the incentives, ask the right questions, and decide who actually wants, who you actually want to partner with this, right? What does their revenue split look like? What does their fee schedule look like? What is their contract? Who handles the monitoring? What's their support look like? Do you have any trained providers on your staff that have done this in the clinic? Or are they just people that wanted to leave clinical care because they want to work remotely? What happens when the insurance questions a claim? What's the compliance track record? Have there been audits? Do you have examples? Do you have support? Ask those questions of anyone you're talking to, including us. We'll answer all of them. There's a link below this video to book a call. I'm happy to walk you through the exact process of how we operate and let you decide. My name is Dr. Andrew Grecki. Thanks for listening to this video, and I'll see you next time.